Hi everyone, it's Pip Brennan from the Health Consumers Council here with Kylie, Hansen from WACOS, and this session is on an introduction to outcomes which Kylie is going to lead, and I will interrupt every now and then with questions, and this is really to help us contribute to the Sustainable Health Review, especially in terms of how we are going to measure outcomes of the review. So over to you, Kylie.
Great, thanks Pip, and hi everyone. It's great to be able to chat a little bit about outcomes with Pip and with you today. So I'm going to go through some slides, but Pip, as she said, is going to interrupt me if there's anything that we want to delve a little bit deeper into. So the first question that we have is, why is it that we're talking about outcomes? And at the end of the day, really, it's all about organisations achieving better outcomes for people, for citizens, for community, and it's important to make sure that we're measuring that, not just the things that were done, like the number of workshops or, the number of sessions that were attended. We really want to understand what the impact of that is rather than just counting the outputs. And we'll go through a bit of that language around outcomes in a moment. Outcomes also really assist us in making sure that the funding provided is going towards those programs and services that are actually making a difference when we do it well. And the Delivering Community Services in Partnership policy is a WA-based sort of state government policy, which really specifically looks at funding not-for-profit organisations and the community services sector generally. And it is often described as an outcomes-based procurement reform. So the focus of DCSP is how we're changing the nature of the relationship between the public service and the community services and the people that community services are supporting. And so outcomes is a key plank of the DCSP policy.
And I wouldn't mind, if you don't mind, just poking my oar in there, Kylie, just from a consumer perspective, the Delivering Community Services in Partnership policy is a really good piece of policy, and it really also speaks to what we're passionate about, which is getting that lived experience voice at the table as well.
Yeah, absolutely. And, it really emphasises why, I'll come back. It really emphasises why we are actually designing services in the way we design services and how we bring the expertise of not just the sector, but people experiencing and engaging with the services to the table to make sure it's not just a service that's being designed without that experience there. So good point, Pip. And so to bring this also, I guess, to where we're focusing at the moment from a consumer perspective is a Sustainable Health Review. And so this is a diagram that many of you will be already familiar with. But really what we're trying to flesh out today is this language of outcomes and how it applies specifically within the Sustainable Health Review, just to give you that language for outcomes as it's being used across the review.
Yeah, and just to poke my oar in again, Kylie, I think the thing about the Sustainable Health Review that we're excited about from that consumer care community perspective is that this reform is really about finding the solutions that go beyond the health walls, that understand, for example, that we need to tackle things like housing. So that's this diagram is really trying to, I guess, typify that or signal that this work, the Sustainable Health Review, that what we're hoping for our state is about the whole of the human being, not just bits of the human being.
Absolutely, yeah. And I think that's the really exciting thing about the opportunity in this is to really think about people holistically and their health holistically, because we know it's just not the medical profession or however we think about it that makes up health. So it's really exciting opportunity. So when we're talking about outcomes, the context is really critical, and you might often have heard debates or arguments even amongst people about that's not an outcome, that's an output, or that's an activity. But I think oftentimes that can occur because we're not being clear about the context that we're talking about. So we can be talking about outcomes at a population or community level. So we can be talking about, the whole of Balga, or we can be talking about all people experiencing mental health distress in Jarrahdale. We can be talking at that kind of population or community level. We can also be talking at a program, service or organisational level. So potentially all the consumers that the Health Consumers Council is working with, or all of the funded services and the people accessing those funded services of the Mental Health Commission. So we can be talking at, kind of a sub-level down from that community or population level. And lastly, we can also be talking about individual outcomes. So those outcomes that people accessing or experiencing services actually want for their own lives. And interestingly, and I'm sure this isn't new to any of you, but sometimes those population community level outcomes or those program or service level outcomes don't map with the individual level outcomes. And sometimes the individual level outcomes can be like a step along the way to those program or service or community or population level outcomes. So it's just being clear that there's different levels, and based on the level or scope that we're looking at, we might perceive different outcomes and activities, and that language in a moment, in different ways. And it's also important to note that we have outcomes that measure process or quality. So particularly, I suppose, related for you, the quality of engagement or the process of engagement.
Yeah, and can I just ask?
Outcomes are, yeah.
Sorry, I was going to say, with the work that WACOS is doing with the Sustainable Health Review team, are you focusing more at the community level outcomes, that kind of level?
So we're doing a little bit of work with this in two different areas. One is supporting them to ensure that the population community level outcomes or the program service level outcomes, so the social outcomes, are actually considering the whole of the person. So a bit of what Pip you mentioned before about making sure we have that social determinants lens to those outcomes. And we're also looking a little bit at process outcomes in terms of partnerships and collaboration. So the extent to which, the different groups and, areas making up the Sustainable Health Review, how do they measure the quality of the collaboration and partnerships that are occurring? So it's not that we're actually going in to measure it, but we're just supporting to develop some of those indicators and measures to help people be able to measure that better. Does that make sense?
It does, and with the recommendation for work that I'm co-leading around consumer and citizen involvement, that's very much, I think, really wanting to start with that process outcome. How are we experiencing the engagement as consumer and carer people? And also how is the system experiencing, undertaking engagement? So that's one of those, I think, those initial focuses we're quite keen to see if we can progress.
Yeah, absolutely. And both of those are really important, right? Because we can develop these indicators and measures for how we think partnership and collaboration should be measured. But then it's about, well, practically speaking, how does that work at an individual group level? And so, that having both of those happen at the same time is really critical. Okay, so that's the kind of social outcomes and the process or quality type outcomes. And so here is kind of, we refer to this a program logic model. Some people also call it a theory of change model. And really what this diagram does is gives us the language for how we can talk about outcomes. So I'll start on the right-hand side because I tend to like to start with the biggest outcome that we can perceive. So if we think about long-term outcomes or impacts, really what we're thinking about is what conditions are we looking for socially, economically, environmentally, and particularly in the Sustainable Health Review, a lot of the language and outcomes that we see are really focused on that bigger picture impact level. Right? If we take a step back from that, then medium-term outcomes are those outcomes that we need to see happen in order for us to get to the long-term outcomes. And so often these are changes in behaviour, in practice, in policy, in decision-making. So they're kind of more action-oriented outcomes, right? And then if we take a step before that one, in order to change people's behaviour and change decision-making and action, you have to have a change for people in their mind, right? Either knowledge or experience or attitudes. And so those are what we refer to as the short-term outcomes. So in a sense, you've got this logic, right, of changing, hearts and minds, I suppose, short-term outcomes to ensure that leads to behavioural change and institutional or, policy change, which then leads to the long-term impact or long-term outcome that we're looking for. And so that's the distinction between the different kinds of outcomes that can vary based on the kind of project or context we're operating in as to what time frame that could be. So short-term outcomes could be, 3 to 6 months, or they could be, if we're looking at a particularly big picture, they could be a couple of years, right? So really highly contextual in terms of what time frame we might put on those.
I know when we had a community conversation recently, we had this conversation about outcomes versus impact. So if I look at that red box there, what I see is I see that they're looking at the short-term outcomes around learning, and it looks to me like medium-term outcomes, like action, but it's the conditions that are the ultimate impact. Is that right?
Totally, yeah. I think, I mean, for me at least, I know that we often use long-term outcomes and impact pretty interchangeably. And so those terms, you know, I mean, yeah, some people will use them interchangeably. Some people will still try to distinguish between impact and long-term outcome. But if you kind of think about, you know, biggest picture we can get to, that's probably what we're talking with either of those terminologies. Yeah.
And I think what we're hoping to develop, you know, one of the things we're looking to is try and get that shared language. So I think the short-term, medium-term outcomes and the long-term impact is perhaps a helpful way for us to think as a group.
Absolutely. Yeah, absolutely. Good point, Pip. And so then if we go back a little bit further then, the outputs, which are often the things that we do measure, are those things like, you know, what are we doing? So, sorry, I should make one more distinction. In this program logic model, we've got activities as mentioned as one of the outputs. Some logic models will pop activities out into a separate kind of box.
I like this box.
Here it's as one of these. Yeah, yeah. And so in terms of outputs and activities, you know, you've got things that, as I say, are pretty easy to measure. So, you know, number of counselling sessions, you know, the work that's being done in terms of developing products or curriculum or resources. So these things are often where we go to in terms of measurement because they're relatively easy to measure compared to the outcome stuff. And obviously there you can also see output in terms of participation, so who was engaged. And you'll see at the bottom of that participation box, satisfaction. So some logic models do really incorporate measurement of satisfaction well, but honestly, some don't as well. And so it's important to be clear that, you know, satisfaction is kind of one of more of those processy or processy outcomes rather than a social outcome, but it's still important to us, right? We still want to understand what people's satisfaction with things happening are. And it's just, you know, important to know, regardless of what the kind of logic model is, that it's still in there in some form. I don't usually go through the inputs and all of the other things around it, but it's just to note that the whole program logic model and this, you know, really outcomes is impacted by a number of different assumptions most of the time. So, you know, there are assumptions that exist that tell us, well, you know, if we are engaging in these kinds of activities, it will lead to these kinds of short-term outcomes. And if we achieve these short-term outcomes, we're assuming, or hopefully, we're relying on research or evidence to say that we will get to these medium-term outcomes and so forth. So, you know, the assumptions or logic that underpins the logic model, it's also important to be clear and transparent about what that is as well.
That's great. And so I just want to pause on a moment because I do feel like this is such a great image. I think it really gives you the image that you can follow through. So I'm just going to quickly go from the left to the right this time. So we're starting with that, the situation needs, then we go, what do we need in the yellow column? Then the green one is what are we actually doing? And those red columns is what's the change that's making. And from a consumer and carer perspective, what we're hoping for is that we are going to be involved all the way along, from the left all the way to the right. That's our goal, and that's really a stated goal of the recommendation forward.
Yeah, absolutely. It's a really good point, Pip. And I think, you know, that's you know, co-design, co-delivery, and then, you know, co-evaluation in a sense, right? And then having that feed that cycle again through. Yeah, really good point.
Yeah.
So I will move on. So that this slide is really very specifically delving into the outputs, outcomes, and impact part of the slide that we were previously on. And just to be really, you know, I guess clear about the logic that sits behind that. So in terms of participation and the number of participants reached, the number of contacts and the intensity of the contact with those people, that's one of those outputs that was in the previous slide. Hoping then to be seeing what the engagement is by clients or by staff or, you know, whatever it is, depending on the context of the project or whatever we're talking about. And then that will lead to certain kinds of changes in knowledge, skill, and attitude. So those learning type outcomes, short-term outcomes. The actions, so the changes in behavior and practices, so the medium-term outcomes. and then the impact. So that long-term effect that we're hoping for individual, for community, and for systems. But really,
so just to be clear, so the outcomes start at the learning stage and the action stage, and that impact is that last little grey box. So what you've got prior to that is you've got more of what are you actually doing, the outputs, what are you doing? Yeah.
Exactly right, yeah. And so I guess really delving into those outcomes, why are we doing this? What we really care about is the change relative to baseline or counterfactual. And I'll just explain what those are. So when we're trying to, so what we've gone through with the logic model so far is how to articulate or talk about outcomes. When we go to measure them, we need some kind of comparison, right? So in order to understand what's changed, we either need to know what was the state before we started doing whatever we're doing. So that's the baseline. Or the counterfactual is what would have happened otherwise. So this is, again, something that won't be news to you, but humans are resilient. And I think sometimes we can think that particular kinds of programs or services, if people haven't been able to access it, oh my goodness, you know, it would have been a disaster and their lives would have been a disaster. And it's often not true, you know, people find other things, people are able to access other, you know, supports or whatever it is. So it's just being clear that we either need a baseline or a counterfactual or some other comparison when we start to move into the measurement of outcomes.
And so, Jen, just getting back to that recommendation 4 around consumer and care involvement, what we're seeking to try and do as one of our early activities is to seek feedback from our existing consumer and care engagement mechanisms, like more process perhaps outcomes, but have a look at where that is now so that we can sort of develop a baseline. That's one of our goals.
Yeah, that's perfect. And really that's what we should all be aiming to do. And I, you know, haven't planned to go too far into measurement, but I will just say that oftentimes we don't have a good comparison because, you know, as services or organizations, people will often start helping people before they get a really good sense of, you know, where they are at. And, you know, that's just the nature of the work that people do, right? You don't want to go, hang on, I can see the distress that you're in, but please wait a moment because I've got these, you know, series of questions that I need to ask you before I give you support. You know, we just start helping, right? So, you know, sometimes we don't have a baseline. Sometimes we don't have a counterfactual. We don't know what would have happened otherwise, in which case we just try and be really clear and transparent about, you know, the fact that we don't ideally have the best comparator possible and we're just doing what we can in terms of measurement. So this is a diagram that people often find useful. It takes that language that we've used in program logic and applies it to baking a cake. So in terms of inputs then, for a cake, you've got ingredients, utensils and recipes for the recipe. With a project, you've got the money, staff, resources and time invested. In terms of activities, the activities are measuring, mixing, baking, slicing, dicing. Maybe we don't dice for a cake, maybe we ice. And then activities, we're delivering counselling sessions. The output then is cake for 10 people. And in the counselling example, it is that 10 people have received counselling sessions. But the outcome is that 10 people are happy and full in terms of the cake, if we're, you know, not gluten intolerant or whatever it is. And in terms of the project, that 10 people are confident, happy and healthy. So you can see the distinction there between the output, the thing itself, and the outcome or the impact of the thing. So I'm going to move now from the articulation of outcomes to talk a little bit about measurement, but as I said, not a lot. So an outcomes measurement framework is a framework that orders and nests outcomes at different levels. So we spoke before about the short, medium and long-term outcomes. And we also spoke about the population level, the service or organizational level, and the individual level outcomes. And we also spoke about the distinction between social outcomes and process outcomes. So what an outcomes measurement framework ideally does is actually take all those outcomes, order them in a way that makes sense, and provides the tools, materials, definitions, and a way to take it through to measuring what's happened with those outcomes. A piece of work that Waycross had worked on initially in partnership with the Department of Premier and Cabinet in WA, and which is now sitting with Department of Finance to further flesh out, is a whole of sector outcomes measurement framework. And this is the final prototype that was the kind of end point of WACOS's kind of initial development of the framework. And it just gives you a sense of the domains and the outcome statements. So there's 7 domains. The sustainable domain was actually added as a result of to say, you know, sustainable is actually really important to us. And it's basically a population level framework. And really the intent of the framework, and Pip mentioned this before, is if we're talking about having a common language around outcomes, this is really to try to give us a common language across the public service and the community services sector, and for people in community as well. Noting there's a bit more to be done in terms of engaging with community around the framework.
And so I just wanted to pause because, you know, I know that you've been really intimately involved in this work, and that's why we wanted the opportunity to have a conversation with you about outcomes. And there's a few things that I wanted to reflect on, and I know that a lot of work was done to have a look at what's happening in other states and other countries. And one of those key things is framing things in the positive. For example, safe, we are safe and free from harm. Healthy, we are healthy and well. And also fairly simple, I think language is much more accessible. And I think what I see as a consumer advocate is I see a whole human rather than people divided up into bits.
Absolutely, yeah. And that was the intent behind the framework, was to ensure that we're thinking about the whole person and from a person-centered perspective. So a lot of other frameworks in other jurisdictions talk about, you know, Victorians are healthy and well, or, you know, whatever it is. Whereas we've made it, we were quite intentional about how do we make it, you know, we and I, and more focused on the person, right, rather than, something that's a bit more distanced or removed.
And one of the things I've been thinking about a lot, you know, because obviously I've been lucky enough to be involved in some of this work when I was on the partnership forum, that intergovernmental and not-for-profit partnership forum that's been going for a wee while. I had thought that sometimes you need a few bits of the pie. For example, the healthy one seems a really obvious one for, you know, most of us who are involved with you know, working with the health system. But there's really important things around connected, especially connected to culture and communities. And I think, you know, there's some really important things about equipped, like that we have the skills to be, you know, effective consumer and carer reps and so forth. And I just wondered if you had any reflections about how many bits of pie, as people are trying to support the Sustainable Health Review, do we need to be thinking about all the bits of the pie, or do we focus on some bits of the pie?
Yeah, no, I think it's really important to be looking at the whole of the pie. And, you know, in any particular circumstance that we're thinking of, there's going to be at least 2 bits of the pie involved, right?
Mm-hmm. That's
right.
really
really presented in this way, just for ease of ordering the outcomes themselves. Because as you can imagine, trying to order population level outcomes can be quite challenging. So, you know, otherwise everything links to everything, right? And in a sense, everything's connected. So really the ordering, the safe, stable, healthy, the domain areas are just for that purpose, for the ordering. But really the outcomes, when you start to look at them, are across everything. So, you know, our mental, emotional and spiritual health is as good as it can be. Obviously involves connection, obviously involves being able to feel safe, you know, and it involves having the skills and experience and resources to be able to engage and access the support that you need. So they're necessarily interconnected, and really the domain areas are just being able to talk about the outcomes, I guess, in a sense. Yeah.
And so the opportunity we have in our state is to develop a bit of a shared language across a whole lot of different areas for what we're trying to see in our communities.
Yeah, exactly right. And you know, this framework and the kind of outcomes and indicators that were populated as a part of it, it's really a starting point towards creating that common language. You know, we just needed somewhere to start so that we can really begin to have that common language. Because at the moment, I think oftentimes we can talk about outcomes in completely different, you know, languages, and, you know, across the public service and across the community sector, let alone, you know, consumers trying to engage with that language. It's very disparate and quite disconnected. So the framework really is a starting point to have that and create that common language. Yeah. There's only a couple of extra things I might note about the framework. So we've talked about the fact it's person-centered. The domain areas are outcomes themselves. it loosely follows Maslow's hierarchy of needs. So, you know, going from safe through to empowered. It is high level outcomes and indicators. So the level of depth that we manage to get to in terms of indicators and measures is continuing work. And in a sense, the Sustainable Health Review is taking that further and starting to embed or drill down into the detail of some of these areas. So that in and of itself is a really exciting opportunity as well. It has been mapped to the Sustainable Development Goals, which are the United Nations kind of big picture goals for countries, signing up to looking at the state of the world, I suppose, goals for 2050. And it was also mapped to our priorities when that was a thing. Hasn't been mapped to the state recovery plan, but I imagine there's some synergy there too. And so really,
just to be clear, the our priorities was West Australian government priorities, and that's, as you said, that's sort of disappeared a little bit, which is in a way possibly good because it means we can stay on the same page with the One Outcomes framework.
Yeah, absolutely. And I think it's important to just think about the outcomes framework as the scaffolding that other frameworks and change models sit within. So the work that we will work on the Sustainable Health Review with will, in a sense, be fleshing out different areas of that pie and bringing it down to something that's practically useful for the Sustainable Health Review, right? So, and that was intentional. We didn't want the outcomes framework to displace any other, particular departmental framework or anything that already exists. So it's broad enough that most things can map up into it, and the Sustainable Health Review can also do that as well. And I really just wanted to, bring it back to the opportunity we have here. And I kind of really have summarized it already, but this is an opportunity for us to drill more detail into the outcomes framework and to make sure that we're thinking about the whole of the person and what it means to be healthy in more than just, I guess, the clinical or medical kind of area of thinking about healthy. And that the outcomes framework provides a little bit of a scaffolding for us to be able to do that with Sustainable Health Review. So that's probably all from me for now. Do you have any questions at all?
Well, I feel like I've asked you many, many questions during...
You have, and you've done a great job.
during the session. And I guess, it's just really what we're really hoping to do here, as I say, is we have, a lot of work through the Sustainable Health Review implementation. And it is really starting to, have a look at outcomes and indicators across a whole range of things. And I know that we are all starting to, as consumer and carer reps, are really interested in how we can contribute to that piece of work. So this, what I'd hoped this would be is this is like a reference piece. If we're going, well, okay, we need to have common language around, outputs and outcomes and impacts, we can say, go and have a look at that video and have a look at that and then come along and join us. So we're hoping that we can do things around safety and quality indicators, what should be reported, what shouldn't be, outcome indicators around engagement. There's kind of no end really. And just the whole outcomes around the Sustainable Health Review, because they were articulated in the report, and so there's some more work that needs to be done on those. So we're really hoping to, empower consumers and carers to be part of those conversations.
Totally, and taking that opportunity, that we have that is presenting itself right now. So that's great. So thanks everyone for listening, and if you have any questions, please feel free to reach out to people or myself.
Thank you so much, Kylie.